Hello guys, my name's Callum. I'm a student healthcare scientist and I work at West Suffolk Hospital in Diagnostic Cardiology. So a day in the life of a cardiology healthcare scientist. So we start sort of learning from the bottom, which is the foundations of sort of ECGs. So we have a ECG clinic, which is a walk-in clinic. We'll complete 12 lead ECGs for clinics sort of all around the hospital. So we'll have referrals from heart failure, consultant-led clinics. They'll send patients down for ECGs, just sort of follow-up ECGs. It can be diagnostic. So yeah, that's a very busy clinic and a good way to sort of begin within cardiology. Similar to that, we have ambulatory blood pressure and ECG monitoring. So those are monitors which patients will take home. They'll wear them for upwards of 24 hours, just to make sure there's no sort of changes seen throughout the day, throughout the night. Sometimes we can put these monitors on people for longer if there's sort of clinical reasons for it. But again, that's quite sort of foundation level, sort of where I started to begin with. So following from that, analysing ECG recordings. So when those monitors come back to us in the department, we have a software which we plug it into, and we'll get the ECG recordings. We'll go through it, look for any arrhythmias, any abnormalities. We'll then sort of decide how we need to flag this to the consultants, back to the GPs, to make sure that patients obviously get the care that they need. So we have a escalation protocol which we follow pretty closely to make sure that obviously anything urgent is seen straight away, and anything sort of routine can just go back and be followed up accordingly. In my final year, I've sort of started learning the basics of more complex procedures. So that within cardiology, we sort of have an invasive and non-invasive sort of two specialisms. So the invasive side of things, we're looking at obviously pacemaker implants, and cardiac cath, which is where they'll use a catheter to, in terms of looking at the coronary arteries. There's loads of different things they can use catheters for. They can even use sort of for valve implants. So it's again something I've sort of just started doing this year, but it's been really interesting, good experience so far. And non-invasive, we have scans such as echocardiography, which is an ultrasound scan, kind of like a baby scan for the heart. So that's something which, again, I've had a little bit of exposure to this year in my third year, and something hopefully I'll be able to get more experience in as I sort of progress further. And then we'll do other tests such as exercise tolerance tests. So we'll get patients on a treadmill. They'll be connected up to an ECG and blood pressure, and we'll monitor them as they do a walk sort of up a hill. So those are all sorts of things that we'll do sort of day to day in the life of a healthcare scientist in cardiology.